Thank you everyone for having me today here. So I'll start with salam, which means peace in Arabic. For those who doesn't know what peace might be. And thank you for showing up here today just to stand for the people of Gaza who has been suffering through the past 2 years. So thank you all. Thank you so much. As well, thank you for having me with these wonderful heroes, Dr. Osaya, Dr. Wajdi, and Dr. Bushra as well. They are such wonderful heroes. They have been in Gaza, helped the people of Gaza, have been there to help those in need. Thank you all. I will start, I will show you a quick review of what the health system in Gaza used to be. So it was my first discussion. Second, I have my challenges and barriers. And last, what is required from me, you, and all of us, or all of the humankind around the world to do for the people of Gaza. So, about the Palestinian health system in Gaza. So basically, we have public health hospitals and centers that is run by the Ministry of Health of Gaza. So we have at the north, as you see here, we have the Indonesian hospital that has been destroyed and out of service for now. We have as well Kamal Adwan, which is a pediatric hospital and obstetric hospital. As well as you all know, the Al-Shifa Medical Complex, which resides in Gaza. So I'm basically from Gaza City, so I did all my internships in Al-Shifa Hospital. So it was my home right there, since I used to sit there with my friends every day. In my rest time, I used to go to the cafeteria there, having a cup of coffee and just chatting with a lot of our friends that's still there in Gaza, helping the people, and some of them have been passed away and has been killed during this war. So moving to the, we have as well the Turkish Palestinian Friendship Hospital, which was the only oncological and hematology hospital in Gaza that has been destroyed as well, and it's out of service. As well, we have Rantisi hospitals for pediatrics and Al-Nasr. And in the middle of Gaza, we have Al-Aqsa Martyrs Hospital. And at the south, we have Nasser Medical Complex and European Hospital that has been destroyed. So as well, we have the UNRWA centers. We had the UNRWA centers. So for me, I'm basically of all, and as well, almost all the people of Gaza are from refugee backgrounds. For myself, I'm originally from a village next to Gaza called Beit Jerja. That's my family. My grandparents has to leave in 1948 to this area. So UNRWA it just works there to help those people with refugee backgrounds. As well, we have the other private hospitals and centers around Gaza Strip. And that what Gaza used to be and used to look like before this genocide. You can see here the famous Gaza board. As well, you see Al-Husayna Mosque. That's the one of the wonderful mosque that used to be in Gaza. So, in this photos, you might see the wards of Al-Shifa Hospital before it has been destroyed and after the invasion. In these photos, you can see this is a case of hyperlipidemia, which increased the fat level in the blood. I remember this photo since this is my first time I see a case that's large. My doctor, his name is Hashim Al-Badri, Abdul Badri, sorry, who has been killed during this war. So I called him straight away, doctor, what is this? Well, I didn't see a case like this before. So he told me this is an exanthoma. It's a case of hyperlipidemia. So I told him, oh, this my first time to see it's that large. Since this case has patient has an inflammation in his pancreas and he's deteriorating without knowing what is happening with him. So we used to share these photos in our common WhatsApp group and just to keep learning new thing. As well, you see the sheets there, the outpatient sheet, so it's just for discharge. And on the right, you see this is Dr. Batniji, is one of the general surgeons of Gaza, giving us some training in the suture skills. Yeah, and this is the Turkish Palestinian Friendship Hospital. This was as I told before, this was the only oncology and hematology center in Gaza that's helped the people with cancer and hematological disorders. Of course, it has been destroyed by the Israeli forces. So now challenges and barriers. For the challenges and barriers, we have blockade, siege, invasion, and destruction. As we see, the Israeli occupation forces has been doing and destroying all the hospitals around the city of Gaza. There's still maybe 2 hospitals that's still running for now, which has Al-Aqsa Hospital in the middle of Gaza, and we have as well Nasser Medical Complex. Okay, and we have lack of supplies and equipment, and this can be seen since when I was there, there is a lot of cases of chronic diseases like diabetes and increasing blood pressure. This patient didn't have the chance to get to their medication. So a lot of these patients used to be coming to the ER complaining of these complications for their diseases. Maybe some get infected food, or some get a stroke or something, or heart attack, just as a complication of these diseases, since they didn't have the access for their treatment. And as you have been seeing during the last 2 years, the workforce is constantly subjected to the lethal force and violence. As you see, we have here a mother holding 2 of her son between her arms. You don't know, for a mother to be in Palestine, what was hard for them to be in the last 2 years. Since there is no good hygiene, they have to just after they giving birth to their sons, they have to go back to their tents and in unhealthy situations. They don't have good access for proper water source. They don't have a good access for food that may maintain this infant to grow. So in this case, you see a case of spina bifida. That's a large with a large bag. It's mutation is caused due to the lack of a couple of minerals that the mother should have been taken during her pregnancy. So she was. So because this deficiency, you can see such a mutation, such couple of malformation of the body of the fetus. As you see, that's the photo that Dr. Sayer showed before. This is what will happen as mass casualty when it arrives to the ER. So we will see a lot of people that's just on the ground, their families screaming at you, doctor, just come and help us, just see my brother and just see my sister. They have been bleeding for hours. But sometimes you can't deal with more than one case in the same time, since there is they comes with these lethal injuries. Some of them can be headed. Some of them has lost the limb. Some of them have been shot to their abdomen. So it will be very, very, very difficult to treat these cases. So next we have these statistics. This is statistics for the people who has been killed for the past 2 years. I think from my perspective, this is not too accurate, since there's a lot of missing people that considered as missing, but I think it might be dead, since there is no news about them in in the Israeli side or something. Okay, so about what we have. So we have about 1,242 of health workers has been killed. 130 of them are doctors, 24 are missing, and 384 has been detained since the 7th of October. So you can see here, this is my photo here. This is the first one is 2023, and the other one is 2024 when I left Gaza. So you can see how the degree of the lack of food has been. So in the first photo in 2023, I weighed about 75 kilos, and in the other one about 62. It was difficult to get into food. Even if when you get sick, you will get sick for longer duration than normal people, since you have this weak immunity in your body. So it will fight this infection by difficulty. So I remember this time I've got this sinusitis. So I've been laid into the bed for about 2 weeks. I've tried every antibiotics, but because there's might be growing antibiotic resistance in Gaza, so it didn't respond to this antibiotics. So I have to be in the bed for about 2 years. Of course, it's not a bed; it's just the car that me and my dad used to stay for about three months. So I had me and my dad to sleep in this car for about 3 months, since we didn't have a place to stay. Okay, so next we have the transports. As you see, this is the way all the people of Gaza, even the doctors, normal people, engineers, teachers, during this war, almost there is no fuel there, so they had to use these primitive ways to get to the hospitals. They are not safe. You might be targeted. I remember every time I had to leave the what's called this Khan Yunis center, where I has been settled in when I moved to the south. So I had to use this donkey carts every day to get from there to the Nasser complex. So it's just a very dangerous way and a very dangerous road you have to go with, since you will not hear anything during this road except the sound of missiles, sound of destruction, sound of the bombing everywhere. So on this picture you can see what we can get as food for us to get some energy to ourselves to continue work during the 24/7 shifts. It's just some bread, some dates, and some protein bars. So next thing is about direct and indirect targeting of the hospitals around Gaza. So in this picture you can see Al-Shifa Hospital, Nasser Hospital, Turkish Hospital, RNTC Pediatric Hospital. All of them has been destroyed to the ground. And honestly, I've got these stories from Healthcare Workers Watch, Palestine. It just says what these people of Gaza and the people inside the Shifa Hospital has been subjected to, and how the degree of their being optimistic, and that they will get this release during the siege of Al-Shifa Hospital. You can see they wrote with pins on the walls, just to send a message for those who might be there. So if they found these messages, they will know that they have been there. So you see, this Dr. Basma Dawood, she says, "We are satisfied with what God has decided for us. We will not despair of the coming relief. It is the God willing." This is Dr. Basma Dawood. And as well, we see, "The pain inside me, if carried by the mountain, would crumble. O Lord, have mercy on our servants." In this picture, so about the targeting of the healthcare workers in Gaza, so I didn't find any examples except my cousins. So in this picture, you can see Just on your right, in my right here, this is Ola Abu Nada. She's my cousin. She used to be a radiological technician in Gaza. She has been targeted. She with her sons, and she lost as well her husband during this bombing and the targeting. As well, you can see there's my brother-in-law, Dr. Yusuf Abu Nada. He is a GB doctor at UNRWA. He has been targeted and has been shot in his arm during his work. And despite he has been targeted, he stayed in his work, helping the people because that's what is he should to be and what it has to be done. And on the bottom there, you see this is my cousin Abdullah. He lost whole of his family, his wife, his children has been killed, and he as well, he didn't have the chance to bury them till the first ceasefire. And this is Abdullah with his reaction to the news of his family getting killed. In this photos, you can see how how violent they got just subjected to this detainee in the Israeli prisoners. So this one here with the glasses, this is my cousin. His name is Yusuf Abu Nada. He is on ICU nurse. So in the first photo, this just one day before the genocide, and the other one at his release during the last ceasefire in Gaza. As well, you see Dr. Mohammed Abu Nada, the director of the Shifa Hospital. We see Dr. Mohammed Hamouda, which is a pediatric hospital at Nasser Hospital. As well, we see Dr. Mohammed Abu Musa, who lost his son during the war, and after 3 days during the invasion of Shifa Hospital, he have been kidnapped. So this infograph shows the numbers of the healthcare workers that held captive by the Israeli forces. Those are our colleagues and friends that has been and they're still there in the prison. We have Dr. Iyad Arantis, he has been killed in detention, as well Dr. Adnan Al-Borsh. We have as well Dr. Hussam Abu Sofia, who is the head director of the Kamal Adwan Hospital. He has been detained, has been humiliated, has been tortured and prevented from the minimum price for him. So this is a list for our doctors that has been killed during the war. This is from 2024. It's a bit old. So this is in the memory of my friends. This is my Dr. Mahmoud Abu Amshta. He's my friend and he's my colleague during my university study, and as well Dr. Ibrahim Kishko. He's my childhood friend, and he was my colleague, and I've lost him during the this genocide. Dr. Basil Mahdi, Dr. Nahid Al-Harazin, Dr. Dina Al-Durra, Dr. Marwan Sultan, Dr. Maher Abu Nada, Dr. Sami Al-Baghdadi, Dr. Abdullah Al-Badri. Those has been our friend. We will keep remembering them, and they will be in our memory for life. Allah yarhamkum. So about other heroes that has been killed as well. This is Dr. Hammam Al-Loh. So during an interview, he has been asked, Dr. Hammam, why you don't want to go to the south? Why you don't want to evacuate to the south? So simply he asked, and if I go, who treats my patients? You think I went to medical school for 14 years so I can only think about my life and not my patients? I'm asking you, ma'am. So that's his answer. Do you think this is the reason I went to the medical school? To think only about my life? This is not the reason I became a doctor. So this is Hammam Al-Loh, who has been killed 2 days after his interview. As well, we have Dr. Saeed Joda. This is a friend for my father here. He used to be an orthopedic doctor in Gaza. He got his son killed. He got injured, and he's still in his work till he has been killed during his way to work at north of Gaza. So this is a wall of honor for our healthcare worker who has been killed in this war. So as Mahmoud Darwish once said, when they are speaking about Gaza, when they are asked you about Gaza, tell them, in there is Amata, nursed by Amata, photographed by Amata, sent off by Amata, and prayed for by Amata. This is Mahmoud Darwish, a famous Palestinian poet. So this is a picture for me and my friends. As you can see, this is Dr. Brahim Kishko that has been killed, Dr. Mahmoud. As well, we can see Dr. Sami al-Baghdadi as well. So, lastly, I want to talk about these wonderful doctors who has been volunteering and advocating for Palestine through their social media. So you have Dr. Muhammad Harara, who was my friend. He provide a wonderful advocacy for Palestine and Palestinian people through his Instagram account. And as well, we have Dr. Azlulu. He's a wonderful doctor who has been graduated 2 days from the Islamic University of Gaza. He lost his family and his dad, Samir, so he established this foundation that's called Samir Foundation, just to help the medical students and medical doctors in Gaza. We have as well Dr. Jamal Salah, who has been a general doctor, and he was helping in the theater room as well as a neurosurgeon as well. And we have Dr. Sara Al-Sakka, who was one of the first female surgeons that get the degree of general surgery from the Palestinian board. We have Dr. Ahmed Farwana. He's my friend and who studied with me in Sudan as well. We have Dr. Mahmoud Mahani. He's a microconstructive surgery doctor and anesthetic plastic surgery. He did wonderful jobs during this war, and he didn't lift his patient till this day. So, what is required now? So we have at least to have a solid ceasefire in Gaza. So despite this ceasefire that has been signed in the last October, the killing continued. There is almost every day a new person is being killed, either by shooting, either by bombing. Honestly, I didn't see that it is a solid ceasefire as they say. I think it is a ceasefire if from one side. So at least we have to get this solid ceasefire and to get this Palestinian Gazan to their life again, to reconstruct Gaza and build new and beautiful Gaza again. So how? So we have to support Palestinian and health worker professionals by advocacy. You have to advocate for these Palestinians. So the moment when Dr. Bushra told me they want someone from Gaza to speak for them, for review and for the audience, for what's happening in Gaza. So I went, of course, Dr. Bushra, this is my duty. That's my duty. I survived this genocide. I came here to Australia just to be the voice of the Palestinian people, the voice of the healthcare worker that has been there for 2 years. Those heroes with white capes, they have been there for 2 years volunteering. A lot of them has not get paid for them. They worked for free. Some of them maybe worked for about $300 maximum. So I think this is my duty here, be standing here today, just to be the voice for those who doesn't have the voice to speak, for the world that That's the Palestinian peoples are trying their best just to survive. They are trying their best just to be among these people in the world, just to show themselves they just want to live. As well, we can as we organize this even just to raise donation for Banzma. So this couple of institutes that I've seen before and I've met some of them. These maybe Australian Palestine Advocacy Network, Banzima, National Zakat Foundation, Doctors Beyond the Borders, Islamic Relief, and Medi Global as well. So finally, I want to thank you all for listening. It was just an honor for me to be here. And I want to end by Mahmoud Darwish saying, peace to this land that's created for peace, yet has never seen a day of peace. سلام لأرض خلقت للسلام وما رأت يوما سلام. Thank you. Thank you so much.